Good afternoon, everyone. Welcome to our seminar today. Our topic today is Health Literacy 101, Use Information Wisely, hosted by Momiji, Japanese Social Services, and Yihong Center. I will quickly share the housekeeping rules. So this section is recorded. Please refrain from recording, taking photo of this section. You will receive a copy of the presentation slides after the section. You will mute during the presentation. The question received via chat will be taken at the Q&A time. And this is optional for you to turn on your camera. So it's very good for everyone to see each other's faces. Hosting organizations. We have Chikage. She is a program worker from Momiji Healthcare Society. We have Rumiko from Japanese Social Services. She is the volunteer and program coordinator. And myself, my name is Fiona. I'm the program worker from Yihong Center. Today presenter, we are happy to have Dr. Yukari Seko. She is the associate professor at the Toronto Metropolitan University, and she is also a board member of Japanese Social Services and interpreter volunteer of our online seminars.
Okay, we can start today's seminar. Yukari-san, please share your screen.
Yes, thank you so much for having me. It's a pleasure to be here and share this presentation with you. As they are introduced, this topic is called Health Literacy 101, Use Information Wisely. So today's table of contents, I'm going to cover 4 topics today. First of all, what is health literacy? Second, how to find reliable health information and distinguish it from unreliable health information. Number 3, communication with healthcare providers. And finally, I'm going to talk about communication with your family members and caregivers or significant others. My expertise is about health communication, and I'm interested in how to improve communication between people. So I'm very happy to share some of the tips that you can apply to your life, like right away. So I have 3 learning objectives for today. Number 1, explain what health literacy is and why it's important for you. Second, as I said, it's very important to distinguish reliable health information from unreliable information. Last but not least, I hope you will be able to know how to communicate with healthcare providers, such as doctors, but also your significant others, like family members and the caregivers. So let's start is what is health literacy? I don't know how many of you have heard about the word health literacy, but it's coming from health and literacy. Isn't that obvious? Put it very simply, the term literacy originated from the word letter, and it means the ability to read and write. However, literacy encompasses various forms beyond just reading and writing, including media literacy, digital literacy, scientific literacy, financial literacy, cultural literacy, or civic literacy. Why? Because these skills are crucial for us to navigate through the modern world where there's so many information, abundance of information we face every day. And health literacy is among those capacity or ability to shape, determine one's health. According to Dr. Kazuhiro Nakayama at the St. Luke's International University in Tokyo, health literacy can be considered as ability to shape one's health. In Japanese, well, we are very lucky to be in Canada because Canada has been the front runner for health communication and health literacy since the beginning of 2000. According to Canadian Public Health Association, health literacy can be defined as the ability to access, understand, evaluate, and communicate information as a way to promote, maintain, and improve health in a variety of settings across the life course. as you notice, I voted 4 verbs, which I'm gonna talk to you shortly, and each one of them. So first of all, you have to obtain health information. You can do so through by talking to healthcare providers, but also you can use multiple medias such as books, television, the internet, or social media. But you have to understand these information correctly. Then you would evaluate accuracy and credibility of these health information as per your health needs. What I wanted to emphasize here is that obtaining or accessing information itself is not the goal. You have to understand, evaluate, and use them appropriately. Therefore, the last step is communicate. Based on accurate health information, you should be able to make an informed decision about your own health. Then, how health literate are Canadians? According to the Canadian Public Health Association's 2003 survey with 23,000 Canadians, 48% of Canadians have low literacy, which is ability to read and write. 55% have low health literacy. But perhaps for your audience today, we have to be mindful about this fact. 88% of adults over the age of 65 have low health literacy, which is back in 2003, and I hope the situation has been changing. However, we have to be mindful of this health literacy gap in terms of aging population. Then you may wonder why we have to care about it. What's wrong to have a low
31. I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
So, so this is a video of the actual story, and this is actual patient. As you see, this lady went through the doctor's office, signed multiple documentations and forms, and went to the surgery. Only after the surgery, she realized that it was hysterectomy. So therefore, people with lower health literacy are having so many risks. For example, they are overwhelmed by misinformation about health. They tend to not be able to take medications correctly or follow the doctor's advice. They may miss minor symptoms of illness. They may avoid preventive health checks and vaccination. They may not be able to communicate their symptoms to healthcare providers, as she's mentioned about, because of the embarrassment. And therefore, they are likely to develop chronic illnesses, and they tend to be hospitalized more so than people with high health literacy. And as a result, people with lower health literacy reportedly have a higher mortality rate.
Shortness of breath and swelling are caused by congestive heart failure. We need to schedule an echocardiogram to find out what the cause is. The echocardiogram will determine your ejection fraction and if there are any underlying issues with your heart valves. In the meantime, I'm going to start you on a couple of medications, Lotensin for your high blood pressure and Lasix for the swelling.
Okay.
Do either of you have any questions?
So I have high blood pressure. Is that my main medical problem?
No, high blood pressure is not your main problem. Your main problem is congestive heart failure. This condition causes your heart to be weaker and have to work harder to pump blood through your body. It can cause swelling in your legs, and it can cause shortness of breath.
Okay, I think my brother may have the same condition. What do I need to do?
First, before you leave, let's schedule an appointment for your test. After you leave, you need to get your 2 prescriptions filled. And finally, you need to take your Lotensin and Lasix. I suggest that your daughter and you write up a schedule for your medication.
A written schedule of my father's medications will help. Why is it so important for him to have the test and take these medications?
Those are really good questions. The echocardiogram will hopefully tell us exactly what's causing the heart failure. The test will also help us find out how far along the heart failure is. It's important to take your medications because you're helping your heart not work as hard. The swelling will decrease or disappear, and you're slowing down the disease. Does that help you understand why the test and medications are important?
Yes.
Yes, I understand. I'll make sure to schedule my tests and take my medications.
In this
I'll
scenario,
stop here. The final top tier at the third level is critical health literacy. That requires you to critically analyze the information you receive about your health and apply to your own health. It also involves advocacy. If you think your situation is not optimal for your health and well-being, you should voice out and start changing your environment. I know it's a little bit complicated in theory, so let me just put it into the practice. For example, you went to a health check and the doctor told you you are at risk of developing diabetes. You listen to your doctor's explanation and understand it. This is an example of functional health literacy. Then you communicate this information to your family, friends, and colleagues and act appropriately based on the information in a supportive environment. Now you know what kind of support you need. So you ask maybe let's say you ask your family for your help. Maybe you get the transportation needs and etc. That's interactive health literacy. Finally, maybe you realize that you don't get enough support to help you to navigate the risk of pre-diabetes. Then you try to change the environment you are in. That's an example of critical health literacy. It's important to use these 3 types of health literacy to achieve your optimal health and well-being. Then how to find reliable health information? It's very important to understand, and also evaluate your health information. Then how are you going to do that? Let's do a quick true and false quiz. Pop quiz. Please think about if these statements are false or true or false. A doctor said, patients who continue this treatment at my hospital are to be cured 100%. Is this true? Is this statement true or false?
false.
Thank you. The answer is false. Why? Because number one, thank you so much, everyone. People who are not cured by this treatment may have left the doctor already. Number two, you have to be aware of the bias in the information and ask yourself, how many people does this affect out of the whole? If this is one person, one patient, and get cured, it's 100%. But if it's like 1,000 patients and 100%, it's more reliable. So you always have to ask the denominator, the whole number, instead of just focusing on the percentage, okay? The second question, true or false? Think about this statement. Functional foods are foods, so it's okay to eat as much as you want. Is it true or false?
False.
Yes, false. Why? Is it because you cannot take, every single food has the risk of overconsumption. And also, functional foods have so many different kinds of benefits and risk. This particular statement is not focusing on the risk of this particular functional foods. So you have to always comparing benefits and risk. If only one aspect, either benefits or risk is mentioned, please consider whether the other side has been forgotten or hidden. This is last to reinforce question statement. There are doctors who promote health products in the media and books for companies. Is it true or false?
It should be true.
Yes, the answer is true.
Don't think the answer is true.
Yeah, the answer is true. This is actually a true statement. The doctor may have received advertising fees from the company. They are not always neutral or not scientific. It may seem prestigious to hear that this was revealed in this research or it was presented at an academic conference. However, there is always there's sometimes some doctors, some providers have conflict of interest. Most of the time, if you receive fundings from any companies or even governments, you have to disclose conflict of interest. So you may want to check conflict of interest statement. And if the doctor or like researchers receive money from the company and say good thing about the company's products, you may have to think twice. So I am sharing the tips for how to distinguish reliable information from unreliable information based upon Dr. Kazuhiro Nakayama's the tips for Kachi mo nai. And I try to translate these acronyms into English by myself. So thank you so much for your patience. I do my best, but like these nuances sometimes get lost in translation. Anyways. First thing, so let's use the acronym PAUSE, P-A-U-S-E. So when you encounter health information, I'd like you to take a pause and check these 5 points, okay? Number 1, P, purpose. What is the main purpose of this information? What is this written for? Is it like persuading you to buy a product? Or is it communicating new scientific evidence to whom, for what purpose? A, author. Who wrote this paper? Who wrote this information? Who say that? Is the author reliable professionals? Who do they work for? Who pays them? U, up to date. Is the information timely? When was it published or updated? It's sort of information for us as a scientist. In our practice, we are told not to cite more than 10 years, like results more than 10 years ago. So in this case, it's 2025. We try to cite the more recent articles or resources and try to avoid, publication before 2015. That's just a customary thing because health information and science is changing day by day. And if you see some of the information cited, the article in 2020, or let's say 2000, or like 1995, it's pretty much outdated. Please make sure when this information is written. Number 4, S is a source. Did you check multiple sources? You may stop checking just one source, but recommendation is at least 3 sources so that you can do the triangulation. If 3 different sources say the same thing, it can be more trustworthy than just one source. So try to check multiple sources. Finally, E is evidence-based. Is this information based on scientific evidence rather than anecdotes or assumptions? Is it grounded on actual data and science? Again, if you are not familiar with scientific language, it's important to check the author and conflict of interest. Even if you do not know about the science, you may be able to trust the author if they are coming from very noteworthy, like, working for the government or working for the university, and they are not receiving any funding from private companies. So next time when you encounter health information, pause and check these 5 things, PAUSE. Okay? So that being said, I really want you to don't be spoon-fed by the media. So the media has so many information, but like as the reason I just gave you, they have many corporate interests in it. So media features one type of information because they want to do so, not for helping you to understand your health. Well, the media has nothing to do with your own health. So you have to take care of your health, not just, believing the media without doubt. Okay, then I'm going to move on to the communication with healthcare providers. I don't know when you went to the doctor's office last time, but please recall your last meeting with a healthcare provider. How long was the meeting? What questions did the provider ask? Did you feel listened to? Very unfortunately, a typical family doctor appointment in the province of Ontario lasts between 10 to 15 minutes, despite the wait time is around 50 to 75 minutes. So which means that you have to wait a long time to meet 10 to 55 minutes with providers because doctors are so busy doing their work and they don't have enough time to take care of all your concerns. Then what should we do? In order to maximize the effectiveness of your meeting with healthcare providers, health literacy experts have developed a communication technique called Ask Me 3. As you see, there are 3 questions this patient, the person in the center sitting on the bed, say that. What is my main problem? What do I need to do? And why is it important for me to do this? Actually, the 3rd question was asked by his daughter. But anyways, Ask Me 3 contains these 3 important questions that patients and family members can ask of their providers to better understand their health conditions and what they need to do to stay healthy. And as you may notice, it's just a 2 minutes conversation, okay? It's just 2 minutes. Even if your doctor only have 10 to 15 minutes in your appointment, you can ask these 3 very important questions and write it down. Therefore, health literacy experts try to promote this Ask Me 3, and it's been well used. It's been used and have lots of best practices in the States and in Canada. So to summarize, there are 4 key tips I'd like you to share and take it to your home and try to use it next time when you go to a doctor's office. Number 1, have a plan for every provider visit. So you're gonna ask me 3, but you may want to have some specific questions about your situation. Maximum 3 questions. Write it down. You want to ask. Also, bring all the medicines you take that include prescription medicines, non-prescription medicines, vitamins, or herbal supplements and whatnot, especially if you have to go to walk-in because you don't really share EMR or any medical history with a new doctor. And that is very important to know what kinds of medications you are taking. Second, ask questions to make sure you understand and repeat back if necessary. Don't be embarrassed if you don't understand. Just to ask them. And if you feel that's too much, what you can do is repeat what they said. Repeat verbatim what they said. And that way, providers will understand whether you understand or not and can use a different language and explain. So ask questions to make sure you understand what they are talking about. Document your conversation with the provider. Write it down. If possible, bring a friend or family member as a note taker. Because if it's not always easy for you to engage 100% in a conversation while taking a note. So if possible, take a person with you. And if it's a virtual appointment, such as over phone or other virtual appointment system, ask permission to have this support person join in the call. Finally, follow the doctor's instructions. If you're not sure, call your doctor if symptom gets worse, or if you're not sure about how to follow through their prescription. Sonia, the last tip is follow the doctor's advice, but you can get this slide after this presentation. Don't worry about it. So because of the time limit, I'm going to jump into the final section, communication with your families and caregivers. It's not easy to tell your loved one about your health. This is because you may feel, I don't want to be a burden to my children, or maybe I don't want to talk about negative things with my children or family members or significant others. So there are common hurdles in family communications according to the family communication family communication studies. Some of the hurdles you may notice, right? Especially among family communication in later life, these are the common challenges. The first one is a lack of active listening. Second, assumptions. Making assumptions instead of asking for clarification. This often happens among family members because you feel you know each other very well. Sometimes if you feel like because they are my family members, like spouse and whatnot, they will understand what I'm talking about. Third, resentful or disrespectful language. Of course, you shouldn't use it, but because of the fact that, family members should be more tolerant than strangers, you kind of believe that you can say something. It's okay to say something like not so nice to your family member. So you don't want to, people are so diplomatic outside of their household, but once they get into the house, they change attitude to their family members. These three things going to create emotional distance. And also other factors such as unsolved conflicts, external stressors. And in case of Canadian household, language barriers is a very but very prevalent challenge. For example, you speak one language to your parents, but you speak a different language to your siblings, you speak another language to your children or stuff like that. So it's not always, monolingual household is not the norm in Canadian context, which is the beauty of Canadian society, but also can cause some challenges. And as you can imagine, some of the factors is changeable by yourself. So maybe unsolved conflict, language barriers, and external stressors might be difficult to handle, but these things are changeable by yourself. Like active listening, assumptions, or stop using resentful message. Just to give you more like evidence-based fact, active listening is a very crucial communication skill that strengthens family bonds by fostering understanding, respect, and trust. To improve communication within a family and reduce misunderstandings, it's very important to avoid assumptions and instead focus on open and direct dialogue. So there tend to be the gap between your assumption, the person's assumption that your family understands you and you understand your family. But research showcases that there is usually the gap between these assumptions. So it's always helpful to talk out and redress or address this assumption. Finally, use respectful language. Avoid words and tones that demean, insult, or stereotype your loved ones. So sometimes we all may have to stop and think the person in front of you, family members or significant others, may not understand me, or I do not understand this person. Then we have to start from there. To summarize, the 5 key tips for family communication. Number 1, know your value. Do you know what's important to you? What is health means to you? Why do you want to be healthy and active? What's your goal? It's very important to know yourself first, then communicate with your family. Second, listen actively and attentively. Instead of trying to talk over or trying to win over the debate, you might want to listen them carefully and try to understand. In this regard, you may want to start using I statement. Sometimes it's called I message or I voice to express your feelings as subjective feeling. So for example, instead of saying, that's such a stupid idea, you may be able to say, I have a different perspective on that. Would you mind listening to what I'm trying to say? Or would you be open to hearing my thoughts? So instead of saying, that's so bad, or like, I don't want to listen to that, can you say, I have a different perspective? Express your gratitude. How many times did you say thank you today? Twice? 3 times? I don't know. Maybe you can set up your goal to say 10 times thank you. Can you say thank you for 10 times a day? Maybe, maybe not. But expressing your gratitude is such an important first, maybe I'd say it's like a really sweet thing in interpersonal communication. Finally, take a solution-focused approach, which means that instead of focusing on a problem, shift your focus onto multiple solutions. Sometimes problem and solutions are not connected directly because what you want to do maybe is nothing to do with the immediate problem. So take a solution-focused approach is more constructive than complaining about your immediate problems. Sorry, I'm thinking about maybe it's almost run out of time. So let me just quickly summarize it. So at the beginning of today's presentation, I said I have 3 things I'd like you to do today. Explain what health literacy is and why it's important for you. Number 2, can you distinguish reliable health information from unreliable information? And I told you PAUSE, pause. Can you stop, pause, and check 5 points? Finally, do you know how to communicate with healthcare providers, families, and caregivers? I told you ask me 3 technique. And I also some of the tips for how to smooth family communication. Last but not least, I put some of the resources in English and also Japanese. All links are embedded in the slide, and I believe PDF version of the slide will be circulated after this presentation. So thank you very much for listening, and I really appreciate it, and I think I'm open to answer any question